Welcome to VetCare. Parturient paresis is one of the most important metabolic disease affecting dairy cows. Today, we will clearly understand why it occurs, how it progresses, how it is diagnosed and treated, and most importantly, how it can be effectively prevented. Parturient paresis is commonly referred to as milk fever, although the condition does not involve an actual rise in body temperature. Other terms used for this condition include hypocalcemia, paresis puerperalis, and parturient apoplexy. Now, let us begin with the basic concept. Before calving, during the dry period, the cow uses approximately 10 grams of calcium per day for maintenance and fetal development. However, at calving, the cow suddenly begins producing colostrum and milk, which sharply increases the cow's daily calcium requirement to about 30 grams. If the cow cannot rapidly mobilize calcium from bone or absorb enough from the intestine, normal blood calcium falls. In severe cases, it drops below 1.5 mmol per liter. This acute hypocalcemia leads to neuromuscular dysfunction. First causes hyperexcitability of nerves. This leads to skeletal muscle weakens, reduced smooth muscle function, and poor cardiac muscle contraction, leading to progressive paralysis. Now let us move to clinical stages. Most cases occur within 48 hours after calving. In stage 1, the cow is still standing. She appears restless and hypersensitive. There may be mild ataxia, muscle tremors, and ear twitching. If untreated, the disease progresses. In stage 2, the cow cannot stand and lies in a sternal position. The cow becomes dull and less alert, with a dry muzzle, low body temperature, and cold ears and extremities. Heart rate rises but the pulse is weak. Smooth muscle paralysis causes bloating, rumen stasis, reduced defecation, loss of anal tone, and sometimes urinary retention. A classic sign is the head turned toward the flank, sometimes forming an S-shaped neck. If still untreated, stage 3 develops. The cow becomes laterally recumbent. Severe paralysis occurs and she may become comatose. Heart rate can reach 120 beats per minute, pulses may be undetectable, severe bloat develops and death can occur within hours. Now let us discuss diagnosis. It is mainly based on clinical findings. If the condition occurs around calving and the cow shows characteristic signs, parturient paresis is strongly suspected. Rapid improvement after intravenous calcium confirms the diagnosis. Blood calcium measurement can support it, but treatment should not be delayed for lab results. We must also consider differential diagnoses, which are distinguished by history, clinical signs, and response to calcium. Toxic mastitis, metritis, or systemic toxemia show fever, dehydration, and foul discharges, with no quick response to calcium. Traumatic injuries or calving paralysis have normal alertness and do not improve rapidly with calcium. Hypomagnesemia causes excitability and tremors, while hypophosphatemia leads to persistent weakness even after calcium correction. Now we move to treatment. At stage 1. If the cow is still standing, treat with oral calcium boluses or subcutaneous calcium injections, such as 23% calcium gluconate. Give 500 ml subcutaneously once in adult cows, divided into 2 to 4 sites, neck or behind shoulder, to reduce irritation. At stage 2 or 3. If the cow is lying down or comatose, give 500 ml of 23% calcium gluconate slowly intravenously over 10 to 20 minutes. Watch the heart rate during infusion. After she recovers, give oral calcium boluses from dropping again. Now let us shift focus to prevention. Ensure enough calcium, magnesium, and energy during the dry period. Avoid over-fat cows, as obesity increases risk. Minimize stress around calving. Reduce infections that can worsen metabolic stress. Routine intravenous calcium at calving is discouraged. If needed, oral calcium is safer. Two modern strategies are widely used. First is the negative dietary cation anion difference, or DCAD, diet. This involves feeding an acidogenic diet for about 3 weeks before calving. A slightly acidic condition in the body makes tissues respond better to parathyroid hormone, PTH, which helps release more calcium into the blood. Urinary pH monitoring is essential. Ideal urinary pH is around 6.5. Too low indicates overacidification. Too high indicates inadequate protection. The second strategy is feeding a phosphorus binder such as zeolite before calving. This reduces phosphorus absorption and stimulates calcium mobilization from bone. Correct dosing is essential to avoid reduced feed intake or hypophosphatemia. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update from VetCare.